Another issue that patients often see me for is for breast lift. This is very often patients who've had children before, maybe have done breastfeeding, and they feel that their breasts have sort of started to sag a little bit, or actually even, oftentimes they say, I feel like my breasts sort of deflated, and it sort of have a deflated appearance, and they would like to have the breasts sort of a little bit higher, lifted, and just a little bit more rejuvenated. I'd say that pretty commonly it's the case where if you see these post-pregnancy breast shape, a lot of times it does have this deflated appearance. A lot of times it does have a little bit of a sagging appearance as well. And so there's sort of, in my mind, sort of two dimensions with regard to how to decide what it is that the patients need. In some cases it's just a breast augmentation with a simple implant. In some cases it's a breast lift. And in some patients it can actually be a combination of both. And I would say that for my patients it's actually really divided about a third and a third and a third. Maybe a third just an implant, a third really just a lift, and a third sort of a combination of the two. It's very much varied essentially based on patients' examination, sort of what their goals are, how they looked before, and yes, basically a combination of all those. So I think the initial sort of assessment and consultation is very important for determining what's the best. In terms of best candidates for things like a breast lift or breast rejuvenation, I would say that the best candidates typically are patients who have finished having children. Their breasts, they think, have kind of finished all the changes that will happen with pregnancy and with breastfeeding, and they're really at this point where they're done with that and kind of want to essentially get some rejuvenation to sort of move on. And so I think in those patients, those are good candidates. In particular, very good candidates are patients who have been overall pretty fit, taking care of themselves with regard to trying to manage sort of their overall post-pregnancy weight. And I say that only because sometimes the breast, in terms of trying to get a lift, it can be difficult to get a lift if the breasts are very large. And so patients who are a little bit more on the thinner side, I think, do have sort of better outcomes. And I think that works very well for them. Let's talk about the procedure. Breast lift can really be done in a variety of ways. I say that for my practice, typically there are three ways that I often see it working for patients. A sort of very classical way is sort of what's called an inverted T method or a Wise pattern. What this is essentially is a specific way of lifting up the breast and kind of essentially lifting up the nipple, putting it into a sort of a more rejuvenated position, and getting rid of all the extra skin that's accumulated. What happens with pregnancy and with breastfeeding, the breasts do oftentimes expand in size, and then as they come down, the volume decreases, but the skin doesn't completely contract. And so that excess skin does need to be removed. In some patients where the excess skin is not so much, the incisions and degree of excess skin can be limited with regard to how much is taken out. And in those cases, you can do a second method called a vertical breast lift, or what's that's also called a sort of lollipop incision breast lift. And in the third, which is sort of the minority, but in some patients, some fortunate patients who really don't have a lot of excess skin and really just have a little bit of sort of a nipple sagging, that can sort of be improved just using a periareolar incision, sort of incision that just goes around the nipple itself. So again, this very much depends on sort of preoperatively where patients are. I usually make that assessment when I first see them in consultation. I make a lot of measurements to really see what the best method is for giving patients their goal with regard to rejuvenation of the breast. Procedure itself varies a little bit in terms of length depending on how much skin needs to be removed, and also depending on whether they need to have an implant placed at the same time. Overall, I would say that the breast lift is done usually about 2.5 or 3 hours. The procedure is quite straightforward. It is done under general anesthesia, so patients are more comfortable. After the procedure, I usually wrap patients up in quite a bit of dressings, put a special surgical bra on them, and have them not touch the dressings for about a full week. And basically at about a week after the surgery, then when they come back to see me, at that point I take down the dressings for them, make sure there's no signs of infection, make sure things are improving and healing well. Most of the bruising swelling does go away in about 2 weeks, but things do continue to evolve in terms of the breast shape and in terms of the incision maturing, especially over the first 6 weeks, but up to the first 6 months to a year. And so that shape continues to improve and change a little bit over time, and that's expected. Post-procedurally, we talked a little bit about some of the recovery expectations. I do tell patients that in the first 6 weeks, I don't like them to be doing a lot of very strenuous activity. anything where they're lifting things over 10 pounds. I know that's a little bit of a conservative number, but I tend to be conservative in most of my approaches to surgery and trying to help people to heal very straightforward way. I tell patients, I'd rather you just take the 6 weeks off of the gym, heal well, and you can move on with your life and go back to all your normal activities, rather than having the healing be prolonged because we wanted to get you back a little bit too soon. And that's pretty much about it for breast lift. Again, a very straightforward procedure. The key things I think for breast lift in terms of getting a good result are sort of really the pre-operative assessment by the plastic surgeon. Really taking measurements, making sure that the specifically planned method for doing the breast lift really matches the patient's body with regard to where the excess skin is. If those considerations are taken into account, people can get very nice results.